question, actually, I'm sure that he's asking, that millions of Americans are asking right now. How do I know if I've been exposed? Joining us is Elizabeth Schneider, who is now recovering from coronavirus. Thank you so much for being with us. First obvious question, how are you?
Hi, yeah, I'm glad to be here talking with you. I mean, as you can see, I'm happy, I'm healthy, I am recovered, I am feeling very much better. I do feel a little bit tired, just similar to how you feel after you've just gotten over a cold or the flu.
You say that you're feeling much better, which is a great thing.
Yeah.
How had you been feeling? Like, what was it like at the worst of it for you?
Yeah, well, I would say the worst of it was the very first night that I fell sick, which was over 2 weeks ago on Tuesday, February 25th. Initially, I just felt feverish. I had body aches. I had a headache. I just had a general feeling of being unwell. I went to bed and I took a nap, and when I woke up and before I went to bed later that evening, I had a temperature of 103 degrees, which in my recent adult life was the highest temperature fever that I've had. And at that point, I was shivering uncontrollably. So at that point, I knew that I was definitely sick, and I was a little bit worried at that point, to the point where I ended up calling a friend before I went to bed to ask if she could take me to the ER in the middle of the night in case things got worse.
And is that what happened? You went to the ER. Tell us how you were diagnosed and what that process was like for you.
Yeah, I'd be happy to share that with everyone. So I actually did not go to the ER that night, and I did not go to the doctor at all. So I actually did not suspect at all that I had COVID-19, the coronavirus, mainly because I didn't have any respiratory symptoms. I had no cough, no shortness of breath, no tightness in my chest, which recently have been the hallmarks of the disease. And I was getting better. So the next morning after I spiked that 103-degree fever, my temperature went down to 101. I took extra strength Excedrin, Sudafed, a lot of water, a lot of rest, and I started feeling better. I actually just thought that I had gotten a really nasty strain of the flu that was different from the strain that was included in my flu vaccination that I get every year. So ultimately, how I found out that I tested positive for COVID-19 is that actually myself and a group of friends who all got sick at the same time, in fact, the same exact day, after 3 days where we had been to a house party, we all started to talk amongst ourselves and wonder what we had. Several of us friends went to the doctor and they were refused coronavirus tests because they also didn't have a cough. So we enrolled in a research study, the Seattle flu study that's been going on here in Seattle, not to test for coronavirus per se. They started testing for different strains of the flu. But in the last couple of weeks, due to the public health emergency, especially emerging here in the Seattle area, they started testing for COVID-19. So I submitted a nasal swab sample, and then this past Saturday, I got a call from the research coordinator saying my sample had tested positive.
Well, Elizabeth, that's a good place, I think, to bring our panel, especially the fact that you said that you were tested by a research panel. You know, who knows what might have happened if you had had to rely on the public health system as it stands right now.
Yeah, can I also say you look fantastic, and I'm sorry you had to go through this. It must have been scary at the time, but we do have with us Dr. Natalie Azar still here, Joseph Ferris still here. Also with us is Yasha Munk, who is an associate professor at Johns Hopkins University. Marcia Santini is a registered nurse at the University of California in Los Angeles. Let me just ask our panelists here, is there a lesson in what you've just heard for people out there who are indeed wondering, could it be me?
I think that what we've been saying for the last few weeks is that, 80% of people will have a mild to moderate illness that can closely resemble a very bad cold or a flu is pretty much exactly what happened. I also think it points to the fact that when we give percentages and we tell people what the symptoms are and we say, fever and cough or shortness of breath and achiness, that not 100% of people have 100% of the symptoms. So you have to have a high index of suspicion. And early on, it required a travel history. Now, of course, it's obviously more difficult as it's more spread.
Professor Monk, one of our audience members asked the kind of obvious question. Joe Biden got to it a bit in his remarks that he just gave from Wilmington, asking quite simply, are our hospitals ready with beds, staff, and equipment for this pandemic, especially in heavily populated areas like where Elizabeth lives, where she, fortunately, was near a research study. Couldn't go to a hospital that had the tests.
Well, I think it's too early to tell whether or not the hospitals are ready. What we're seeing in countries from China to Italy is that the spread of this disease is exponential. So it's possible to have 100 cases today, 1,000 cases a week from now, and 10,000 cases 2 weeks from now. And as these cases spread, you have people coming into intensive care with very, very serious symptoms, very serious respiratory failure. Not in every case, as you've just luckily seen, but in a significant number of cases. And what we're seeing in Italy in these days is a lot of hospitals no longer having the capacity to treat all of the patients, no longer having the medical staff, and most importantly, no longer having the intubators that they need in order to ensure that people can survive. So I think the first priority right now is social distancing, to make sure that we stop the spread of this disease by staying at home, by canceling all of these events. But the second, and Vice President Joe Biden has said this very well, is to increase the capacity of ICUs on an extraordinary basis. And I very much hope that the government, the administration, heeds Joe Biden's recommendations in that respect.
And Marcia, you obviously have been on the front lines of this, as nurses often are. So what is the one thing that you would like to get out there? What do you want people to know based on your experience?
Well, what I'd like people to know is that we need to do everything we can to protect our healthcare workers. And how can we do that? Each one of us has to take a part in this fight. People need to socially isolate, like we've been saying over and over. You need to stay home. We don't have the testing capabilities, and we cannot overwhelm our healthcare system. Our healthcare system is not designed to handle a mass pandemic. We now often we operate at 100%. So to take in an influx of very sick patients is going to collapse the system. So we need to do everything we can to slow the progression of this disease and not get sick all at once. They talk about the curve. We need to flatten that curve. And hospitals need to protect their nurses. We need equipment. We need the highest protective gear. If we get sick, everybody gets sick.
I know we're low on time. Oh, I'm sorry. I hate to cut you short, but I know we're low on time, and I did want to ask because there are so many more questions we wanted to get to. What are the top questions that you have right now? We're going to do this again tomorrow. What's the number one question you'd like answered right now?
I want to know when I can start testing patients I think need to be tested.
Just the same question. We have to know the specifics on the test, where to get them, where you can go now. We just heard from a recovering patient. That's exactly the kind of audience we're trying to reach when people accuse us of fear-mongering. She may have, traveled because she had no idea, and most people won't have any idea because they are going to have that mild to moderate symptoms, but you still are infectious to others that are in the high-risk category. So that's why we keep emphasizing that if you have any kind of symptoms that could be related to this, we need to social distance.
Joseph Fair, Dr. Natalie Azar, you guys have been fantastic to be with us for the